Kate, does it look like we're ready to start?
Yeah, you can go ahead.
Okay, great. Well, good morning, everyone. My name is Sharon Rich. I am the Senior Trust Advisor with Advocates and Guardians for the Elderly and Disabled. This is our Aged Monthly webinar, and thank you so much for attending. My background is as a trust officer for about 30 years, and I've been with Aged for 12. So all we do at Aged is manage special needs trust. So all of our clients have some sort of disability or they're seniors and they need extra benefits. So today we're going to learn about some great programs that can potentially help your clients reduce their out-of-pocket cost. Before we get started, I wanted to make sure that everybody knew that the program is accredited for guardians and attorneys and waiver support coordinators. You will receive a certificate of attendance after the program within about a week from Kate. And if you're a guardian, we'll be submitting the CEs for you. We are recording the program, and it will be available afterwards also on our Aged website under our training tab. So we have all of the past trainings that we've done for everybody on our training tab under our trustaged.org website. So I hope you will take advantage of those also. We have put everybody on mute. So please put questions into chat, and we should have enough time at the end to address your questions. So I'm going to go ahead and get started now. Today we're talking about benefits. This is Aged's mission. We manage different types of special needs trust. So all of our clients are trying to qualify for Medicaid. And if you have a client who's over the income or the asset limit and needs Medicaid, whether it's long-term care Medicaid or the medical Medicaid that we're going to talk about today, a trust is one option for qualifying. If you are a guardian and you're not familiar with our guardian mentoring program, I encourage you to go to our website and consider joining. It's a fantastic program that we support here at Aged to put together experience with guardians with other guardians that are not as experienced, to mentor and do training and discussion. So it's a fabulous program. Today's program is, we're going to talk about different Medicare choices. I had a program back in 2 months ago where Mitch Gordon talked more in detail about Medicare, but I want to focus today on the low-income subsidy and how it keeps you out of the donut hole, what the requirements are, what the benefits are, and the Medicare savings programs in more detail, and specifically what they are and how to qualify for some of these benefits by using a pooled trust. I'm going to chip away at your knowledge and hopefully get you a few little nuggets today that will be helpful. So the basics on Medicare, and we're going through enrollment season right now to change plans, review plans, etc. for your client. So I hope all of you are doing that. If your client is on original Medicare, that means they do not have an Advantage plan. They have their red, white, and blue card. They're using that. That gives them A and B, hospital and doctor coverage, but that only covers 80%. So some clients can afford to have a supplement down on the left side here that covers that extra 20%. When they have original Medicare, they need to also have a Medicare Part D plan. So if you're trying to figure out what benefits they have, You have to kind of look at their cards, their insurance cards, and see what it says. Is it a supplement with a D, or do they have a Medicare Advantage plan like a Humana or a United that combines all of the A and the B and the D together? And usually there's no additional cost for that, but when you do have an Advantage plan, you have to still pay your Medicare Part B premium. This year, that's $164.90, and it's going up to $174.70 next year. Some people that have an Advantage plan can not still afford their prescription drugs because of the donut hole potentially, or just expensive prescription drugs. And also you have to pay copays when you go to the doctors and the hospitals. So you may have to get an MRI, and it could cost you $100 to maybe $300. You may need to have a surgery. And if you have somebody with limited income, limited assets, you know, they could end up spending $4,000 or $5,000 on a surgery. So I'm going to tell you about some programs that can add Medicaid as a supplement to Medicare today. And that will reduce those out-of-pocket costs down to zero for the copays for the doctors and the hospitals. Some people say, well, what happens when you have Medicare, you have an Advantage plan, let's say you have a United plan, and now you get qualified for Medicaid. So you would go back to your United company or your insurance rep and say, I've now qualified for Medicaid, I'm dual eligible, and they would switch you to the United dual eligible plan. Usually you can have the same doctors on those dual eligible plans as you have on the current plan. So again, but like a United would have a network of doctors that you have to stay within. So that's kind of the difference between original Medicare and a Medicare Advantage plan, where you have to stay within your doctors. If you are on original Medicare and you get Medicaid, then you don't have to go to an Advantage plan, but we are going to talk about some of the extra benefits that some of those plans have. Andy is our prospect today that we're going to talk about. He is 78 years old and lives in a manufactured home with a couple dogs. But as he's aging, he's got now the diabetes and some heart disease. And, you know, things are progressing. Now he's a little bit depressed because of all his medical conditions. He's got some COPD going on. His medications are costing him $300 a month. And he needs knee surgery. He has an Advantage plan, but with the Advantage plan, you know, he could end up paying up to the maximum of $5,000 with his plan in my example. So that would be kind of devastating for Andy because he only has $14,000 in savings and he's living on Social Security. That's his only income, $2,000 a month. But he has to pay for his rent, his utilities, all of his, you know, monthly bills are equaling his income. Plus now he's got medication costs and medical copays. So his total monthly expenses are exceeding his monthly income. So he is dipping into his savings every month to pay for everything that he needs. So his money is going to only last him about 2 years. Andy's trying to cut corners. He is struggling financially. So sometimes he doesn't take the medications he's supposed to take or buy food that he has to buy. You know, he's got to pay for his animals too, and his vet bills, and his food for the pets. So he also needs knee surgery. And so Annie's wondering, is there something that can help me to better afford all these things that I need? So Andy may be in the donut hole. His Medicare, this is called the Medicare coverage gap. It applies to prescription drugs. I'm going to explain to you how this works. These are the 2023 numbers. This will change a little bit for 2024. When you have a prescription drug coverage with Medicare, you have a yearly deductible, and it can go up, be as high as $505 for the year. You're paying 100% of the cost of the drugs when you're in the deductible phase. Then you go into the initial coverage phase, which is where you pay small copays, and the plan is paying the larger portion of the cost of the drug for you. So hopefully the drugs aren't real expensive when you're in initial coverage, but they still can be. Once the total cost of the drug reaches $4,660 from January 1 through December 31st, once the total cost of the medications is $4,660, you go into the gap. And during the gap, your copays go from smaller copays to larger copays. So you're now cost sharing a much higher percentage of the cost of the medication when you're in the coverage gap. It's a little bit harder to get out of the gap than it is to get into the gap, because what you pay has to reach $7,400 for the year. So just think about that. If you had to spend $7,400 for your medications for the year, that'd be a big chunk out of your pocket. We want to help people stay out of the gap. If they do get out of the gap, and sometimes this happens with like cancer drugs or something like that, you have the catastrophic coverage. And once you get catastrophic, you're paying a very small amount, about 5% of the cost of the drugs. So we want to help people stay out of this gap. One of the programs that the Medicare savings programs can help them stay out of the gap. So again, we're going to talk about these different programs here. So let's go into the low-income subsidy. This is a fabulous program. It's actually managed by the Social Security Department, but is part of Medicare. If your client fits within these income and asset limits, they can get this benefit. And the income limit for an individual is total income for the month has to be less than $1,823. If they're married, the couple can only make $2,465. And they're going to count all income, pensions, Social Security. The only VA aid and attendance does not count towards these limits, but just about all your monthly income does. If you have an IRA that's paying a monthly income, that's income. Countable assets, a house doesn't count in Florida, and a car doesn't count. The house has to be less than a certain dollar amount in value, but it's pretty substantial. It's over $400,000. So if your savings, checking, etc., are less than $16,000, you can qualify for this program as long as your income is below the $1,823 limit. What do you get if you qualify? All of your medications are going to be $0 to $10 pretty much. I use that as a general term because it's easy to remember. Every year Medicare has the specific numbers for the generics and the brand names. But basically you're paying less than $10 for your medications. your Part D, the prescription drug coverage, annual deductible expenses, this year, most of that is paid for in this program, and the premium. So if you have a Part D premium that you're paying, they have historically paid up to about $35 a month. Now, next year in 2024, this program is actually expanding benefits, and it's going to cover all of the annual deductible for the Part D, that $505, and it's going to pay for your Part D premiums. So that's really good news. Another reason to really look at your client's income and assets and see if they qualify, get them these extra benefits. There's no donut hole or coverage gap. So this is all about medications, the low-income subsidy. How you apply for it is by calling the Social Security Administration, or applying online with a link that I've given you here. Or you could potentially qualify for this program if you have full Medicaid coverage. So if you have like community Medicaid or even the long-term care programs with a Medicaid, this low-income subsidy is what gets them their prescription drug coverage at a very low cost. You can have one of the Medicare savings programs that we're going to talk about on the next pages. That gives you the low-income subsidy, or if you're on SSI, your drugs are covered under this also. Now, what's nice about this also is that when you have this program, you can change your plan. If you have an Advantage plan and it's not working for you, you can potentially change 3 times a year as opposed to just once a year, like most Medicare recipients. So that's another advantage. All right, so let's talk about some programs that have additional benefits. So they have the extra help, the low-income subsidy for the drugs, but they are also going to give you extra benefits. The QMB, I have a separate slide on this because this is what we try to get people on if they need help with other things other than the drugs, and they can't, or if they are over the $1,800 limit. So QMB is going to cover additional things like your Medicare premium and your co-insurance when you go to the doctors and the hospitals. But note that the limit for this program is less than that $1,800 limit. That's because it gives more benefits. The asset limit is also different. It's $9,090 for an individual. Now, SLMB or SLIMB pays for your Medicare Part B premium. The income limit's higher. QI1, the income limit is even higher. Again, the higher the income limit, the less benefits you're going to get. These programs you apply for through DCF, Department of Children's and Families. That's where most of your Medicaid, unless it's SSI Medicaid, is applied for. So here's my slide on QMB. If someone comes to us and they really need this kind of help, this is the program that we're going to try to help them get qualified for by using our trust. Again, like I've said, you get the low-income subsidy for the meds. Now, you also get your Part A and B premium paid back in your Social Security check. So when someone gets qualified for QMB, Social Security will send them a letter and say, your Social Security check is going to go up next month. And also they will back pay to the month that you got qualified. So if it took you 3 months to get qualified, they're going to give you an extra 3 months worth of your Medicare premium. Now, Part A is generally free for everybody, but Part B, this is the standard. Remember, it's going up next year. Your Medicare deductibles are covered by Medicaid, that 20%, and your coinsurance and your copays are covered within the prescribed limits. So basically, if you have QMB, as long as Medicare approves the expense, then Medicaid is going to cover the balance that Medicare doesn't pay. So if you go to the doctor and it's a specialist, you're not going to have to pay. If you go to physical therapy, not going to have to pay. Go to the hospital, you don't have to pay with this program. So it's Medicare, Medicaid coverage, also known as dual eligible. Fantastic way to reduce out-of-pocket cost. Now, the other programs that I mentioned, SlimB and QI1, there's no help with the deductibles and the coinsurance. So you're getting the help for the medications and you're getting your Part B premium paid, but you're not getting coverage for the doctors and the hospitals. That 20% is not covered. You're still going to have to pay out of pocket for that. And the QI1 only, the Working While Disabled program is really for people that have lost Social Security disability benefit due to employment. So, they're not getting the they've lost their coverage, and it's only going to pay for the Part A. They've lost their SSDI, and so, but I guess they still have Medicare for a certain period of time. So we're back to Andy. We're going to talk about Andy and how we can make his money last longer. Instead of 2 years, what can we do for Andy? We're going to talk about a pooled special needs trust today. Again, I alluded at the beginning that this is a way to qualify for government benefits when you're over the income or the asset limit. There are different types of special needs trust that I have outlined on this chart, and I have a whole 1-hour presentation in my training section on the differences in these trusts. Today, I want to talk about the pooled trust. We're using this to qualify for Medicaid. Some of you might know what a qualified income trust is. You can only put income into that trust. The pooled trust is different because you can put income and or assets into the trust. So both are allowed. Some accounts we have, and they use a trust just because they're over the income limit. Sometimes they're just over the asset limit. Sometimes they're over both. Pooled trust can be used in those situations. One of the rules, the federal rules, is that the person has to be considered to be disabled or meet the definition of being disabled in order to use a pooled trust. So if the individual is under 65, that typically means they're on the SSI benefit or the SSDI benefit, or applying for, and they can, we're pretty sure they're going to get it. If the individual is 65 or older that wants to use the trust, when the application is done to DCF, a disability determination has to be done. DCF sends it up to the Department of Elder Affairs. They have a group up there that will review medical records. So you have to collect medical records and send those up. One of the things to keep in mind is that if an individual is 72 or older and they have any kind of medical impairment, that impairment is usually considered to be severe. Really, what we're looking at is the same definition that Social Security uses for disability, which is on the bottom of the slide here can't go back to work full-time for a period of 12 months in substantial gainful activity. If someone comes to me when they're 65 years old, just going on Medicare, and they're still working a little bit, usually the trust is not going to be appropriate for them or work for them. I do have people, though, that are older and still maybe work a little bit. As long as they're under the substantial gainful activity number, like 1,400 is going up next year. I think it's going to be over 1,500 next year. Then they probably can qualify. So someone that doesn't have a lot of medical conditions and is still working probably cannot use the trust. When money's in the trust, what do we use to pay for it? People, this is, the biggest thing is like, well, I'm giving you my money. Now what? We pay for the trustee, which is aged, will pay for things that the government benefits do not pay for, as long as it's for their sole benefit. What that means is if I have a married couple, for instance, and only one spouse is using the trust, if their rental agreement is in both names, I can pay 50% of the rent from the trust. If the electric is in my beneficiary's name, I can pay the electric bill. So we have to be very careful. I can't pay for grandchildren's gifts and things like that. There are some restrictions if the beneficiary is on SSI, Supplemental Security Income. I would say if you want to use a trust for someone on SSI and you've never done that before, please give us a call. And there are also age challenges when someone is 65 or older and on SSI. That's Supplemental Security Income. That's a $914 payment. Okay, so give us a call if that's the case. At death, funds are retained by the trust, aged, or can be used to pay Medicaid back. In aged's trust, we allow heirs to be named. However, the federal rule is that any balance in the trust, when someone passes away, we have to write to Medicaid and say, how much did you spend? So if you've named heirs in the trust document, Medicaid has to be paid back first. We have a process that we go through to write to Medicaid, get their lien letter back, and if there's enough money in the trust to pay Medicaid back, we pay them back, and then the balance goes to heirs. Aged's documents, we retain 10% before any of that happens. Here are all the codes in case you're wondering. I get comments from time to time that say this sounds too good to be true. Well, we're managing to the federal code, to the Social Security code, and to the DCF code. And the DCF code says a Medicaid pooled trust for disabled individuals is a legal instrument that meets the criteria in the U.S. code and allows disabled individuals to place assets and or income into the trust to qualify for Medicaid. And there's their manual. It's in the 1600 section about the pooled trust. So we didn't just come up with all these rules. There's, you have to be a nonprofit organization in order to manage a pooled trust. There are about 10 or 12 pooled trust companies around the state of Florida. We happen to be in Central Florida, but cover the whole state. Here's a great chart on the way to think about a pooled trust. You've got income and assets in your client's bank account. If you're wanting to do the trust, you're going to put the overage into the trust, and then the trust is going to use that to pay bills. It's as simple as that. We have a process, a disbursement form. You send us the form with a backup, and then we evaluate and get it paid. It's really as easy as that. So let's talk about Andy. He establishes a pooled trust. He had that initial $14,000. He's going to put $6,000 into the trust, and that leaves him with $8,000 outside in his checking account. This is going to get him below the financial asset limit for QMB. Now, Andy also has monthly income. He's going to transfer every month $800 from checking into trust. We have a form that allows us to do that for Andy if he wants us to. So, automatic $800 a month goes into the trust. This reduces Andy's countable income to $1,200, which is below the QMB limit. So Andy is going to qualify for QMB. His meds are going to go down. He doesn't have to pay copays for the doctors and hospitals. He has a knee surgery and pays nothing. He goes to physical therapy and pays nothing. And his Social Security check goes, his check goes up. Oh, I need to go back. And his Part B premium is being paid for him. So on the next slide, we talk about how his income is increased because the Part B is paid. Aged has a $115 monthly fee for accounts in this scenario for Andy. But again, he's getting his $165 back in his Social Security check. So Andy's income actually goes up by $50 a month. His medical expenses are reduced. He then switches to a dual eligible special needs plan. He's going to go back to United or Humana or whomever that he has the plan with and get switched over. So not only is he saving on the medical and the income, the plans actually have extra benefits also. This is really going to let Andy get the health care that he needs, and his money is going to last longer, perhaps indefinitely in this scenario, because we're reducing his out-of-pocket expenses. So his income is sufficient, hopefully, to pay for all his expenses. I wanted to touch on the dual eligible plans, the special needs advantage plans, because they are continuing to increase the benefits in these plans. And if you have a plan like this, there's extra dental coverage benefits, there's extra vision coverage. Now, it's not complete full for all dental and all vision, but it is a lot more than just traditional Medicare. Andy will also get an over-the-counter health-related prepaid card. These are the Flex benefit card you see there. You can, pay for things on that card. It gives you a healthy food benefit. And sometimes these plans also have utility expenses that can now be paid with the extra benefits that the plan is actually giving you. Some of the plans have transportation included also to doctors' offices and things like that. So not only are you saving on your copays and your medicines, you're now getting a card with extra benefits and where you can buy food and other things at the drugstore and, just get more benefits. So it's really helpful to the people that need it. So with the trust, we pay lots of things out of our trust accounts. We pay, medical and dental that's not covered by the government benefits. Food and shelter, we pay lots of mortgages, rental bills, cable, electric, etc. Again, when someone's on SSI, we have to be careful about paying for food or shelter. And that's a discussion that you need to have with us ahead of time. Purchases of goods that add quality of life. We buy televisions for our clients, furniture, pet needs. There's different ways that we pay these things. Either, we get an invoice, or we have a credit card that we can, use it for the client when they're at Best Buy, if that's workable. We also can issue TrueLink cards and pre-fund those. Those are allowed under the Medicaid and Social Security rules now. So lots of different ways that the payments can be made. A lot of the payments are just via check or sometimes ACH. Caregivers and companions and guardianship care are a lot of the things that we pay for out of the trust, whether it's a family caregiver or a professional guardian. Private health insurance, if they are long-term care, rehab, transportation. Sometimes people need Uber, that kind of thing. And we'll pay for travel and visits too, to family. We have to make sure they're not, wanting to pay for the entire family to go to Disney World. We're only going to pay for our client, our beneficiaries, travel expenses, and one companion to, accompany that person. We're not going to pay for the whole family. All right. People think of trust and they're like, what is this? Really, when you have the trust account, you're going to get quarterly trust statements. You're going to, if you need a disbursement request, the trustee has to, write the checks, pay the bills. So you have to submit your request to the trust company. At Aged, we have ability to give you online access to view the trust account activity. You can get statements online, balances, and all of that. But you can't write checks. Fees. Every pooled trust company is a little bit different. I alluded to our minimum fee of $115 earlier for our QMB clients. If the account is more than $50,000, 2.5% applies on our fee. You have to look at the schedule. If you're assessing what trust company to use, always, find out what their fees are. And we do have a discount program too for certain circumstances. Aged will assist with the QMB Medicaid application for income-only clients. If you have someone that doesn't have any savings, is not working with an attorney, and can't, we'll do the Medicaid application for them. I have 2 benefit specialists in the office here at Aged. This is one thing that does set Aged apart, that we get very involved in making sure our clients get the Medicaid and can keep the Medicaid also, because you have to reinsert once a year, at least once a year for the DCF Medicaid. Sometimes food stamps, they have food stamps, and it's a different recertification. Don't understand why DCF can't put those two together and do it at the same time, but sometimes they're at different times for food stamps and Medicaid. So that's, you do have access to our benefit specialists, and we actually review, if we get medical bills for any of our clients, our benefit specialists will take a look at those and make sure that it's really appropriate to pay. We like to be a resource for our clients and the community. So you say, well, how do I set this thing up? There is, under a pooled trust, there's always a joiner agreement and a master trust. And of course, there's other legal documents that each trust company will have, like a fee agreement, etc. The joiner is a legal document that has to be filled out, notarized, and signed and witnessed. We can help if we're local. If you're helping, a client, you can fill it out, send us a draft in advance. We'll take a look at it before it's signed, etc. We'll help you with the documents. All of them are on our website. Provide a copy of proof of identification that's needed. You fund the trust. The day you fund the trust is really the day that you're technically qualified for Medicaid. There's no waiting period. If you are a professional guardian or a private guardian, you must get a court order to allow you to establish and fund the trust. And we do have a sample petition on our website for that. Aged, once we get the documents, we have to accept as the trustee. And so we do our acceptance and all of that gets notarized. We send a welcome package back to you, generally via email, with copies of everything that's been fully signed and a welcome letter that explains the trust. Then, once all that's done, the account is set up, and that doesn't take very long. Whoever is doing the Medicaid application has to provide all of that to Medicaid. If it's DCF Medicaid, you provide it to DCF. If it's SSI Medicaid, Social Security has to be notified. Now, we're not attorneys, so we want our clients to be working with attorneys if they've got, substantial assets or anything, more than $20,000 or $30,000. Got to find out what all the benefits or what the options are. A pooled trust is one option for qualifying for Medicaid. Here's a nice little diagram that talks about all of the scenarios whereby someone may need a special needs trust. And this is all, again, you have to be a senior, not working full-time, or a person with a disability. A lot of developmental disabilities, group home clients too use the trust. When you might not be able to afford the medicines, can't afford the doctors and the copays. Those are the programs we talked about today, the Medicare savings programs. Entering a nursing home, and you have $50,000 left, $100,000 left, whatever. A lot of the elder law attorneys are using pooled trust. Put the excess assets into the trust. Now you can immediately qualify for Medicaid and save your money, to pay the guardianship fees out of the trust, to pay for the extra care, to pay for art supplies, lots of different things. We pay for out of the trust. If the individual still has a home, we can pay for the home expenses even when they're in a nursing home, generally. Another reason people do pooled special needs trust, you've got someone on Medicaid and their patient account at the facility starts going over that $2,000 limit. Or they're on Medicaid and they receive money. How often have you seen that? Do a lot of trusts for this. They've sold their home, they've received an inheritance, or they're getting a settlement. So on Medicaid, and now you're coming into money, a pooled trust is an option to protect the benefits generally. Spot opens up from the wait list, home and community-based services, and the person is over the income or the asset limit. We get a lot of calls for people that need to help paying for assisted living. There is a program called Home and Community-Based Services. It's a part of the long-term care program that will pay part of assisted living bills, generally up to about $1,600 a month. Gives you extra benefits too, but there's a waiting list for that. We get a lot of calls from people getting off the wait list, your area agencies on aging. Some of them know us and will send clients over to us, or people like yourself that need help with that. Because you only have a certain period of time to qualify for Medicaid once you get off the waiting list. So just remember that. This is a diagram of basically what I just talked about, the different populations of people that can benefit. And this is for Florida. There are people that moved down from New York, and the benefits in Florida are not nearly as robust as they were in New York. And just know that you have to be a Florida resident before you can apply for benefits. So people that are getting services in New York, for instance, at home, they're going to lose those benefits when they move to Florida. They have to get on the wait list for benefits at home once they move to Florida. So it's always an evaluation. We talked about the QMB today, but again, these are all other programs. And there's a big financial chart that I did not put in here because each program has different income and asset limits. So today we talked about low-income subsidy, fabulous program. The QMB that includes low-income subsidy plus gives you extra benefits, and how to qualify by using a pooled trust when you're over the financial limits. This has a lot of websites for you as references. And CMS, the Centers for Medicare and Medicaid, they have a fact sheet for 2024 that's out that talks about what the deductibles are going to be next year, what some of the different financial numbers are going to be for next year. Everything is going up. Social Security checks are going up 3.2% in 2024, FYI. So we really thank you for attending today. And we do have about 10 minutes to take questions. So I haven't looked at the chat yet, but I'm going to look at the chat. And all right, where's my chat coming up? Here we go. Okay, Kate put in the Guardian Peer Mentoring Support Group link for the guardians. Okay, so I don't see any questions in there. I'm going to stop sharing and give people any more time. Okay, I think I see a chat. Wait a minute. Was that an email? Okay, wow, my goodness. I'm going to give you back 10 minutes today. Please use us as a resource. We like to help. Hi, Patty. She sounds like she wants to. Kate, do you want to go ahead and unmute people? We have a few minutes. Maybe we can, whoever wants to stay on, if you want to have a chat. Are we able to do that, Kate?
Can you hear me?
Yes, I can.
It was just too long. It's not that long of a question. First of all, thank you, Sharon. I enrolled my client, I'm a guardian, with Aged, and I have been so happy with your company. The advice that you've given me on so many different Medicaid and Medicare related issues has been just invaluable. And I can't say enough for your company. But that aside, I'm curious about this QMB. I was not really aware of it, but it sounds like a fabulous program. But you don't have to be on it's not a Medicaid program, correct?
It is. Yes, it does have a Medicaid component to it, but you have to be on Medicare first. So you have to be on Medicare, and now it's like Medicaid as a supplement to your Medicare. That's the way to think about it. It's Medicare with Medicaid.
I'm curious because I'm thinking about what was the gentleman's name?
Andy, the example.
Andy's example, because he had like $8,000 in income that he was able to or maybe assets. 8,000 in assets, and is way above the Medicaid income level, or excuse me, asset level. So how can
remember the QMB limit for assets is just over $9,000.
Okay,
so Andy actually had $14,000 in assets. So we put 6,000 into the trust that left him with 8,000. And people don't really, a lot of people don't realize that Medicaid asset limits are not always $2,000. Your long-term care programs are really all the $2,000 limits. Okay.
You're right. That makes sense now,
right,
that there's separate asset and income limits depending on the program.
Yes, right. So you're allowed to keep more. You don't have to. You can put more into the trust, but let's say someone is on, and we do this a lot. We do a QMB. We'll get them on QMB while they're on the waiting list for the services at home or in assisted living. And then once they get off the waiting list, though, they have to make sure that their assets outside of the trust are 2,000. So they can add money if they still have more than that outside of the trust. So
it sounds like a great program.
So to me, it's all about, I kind of just realizing that there's a program out there that gives these kind of benefits. And then if you're, not super familiar with it, just give us a call and we can kind of help you through it.
Yeah, great. Thank you very much.
I see a couple things in the chat here. So great information. Yes, we will be getting the trust slides. Kate will send you, a copy of the link to the presentation. If you want the slides in a PDF form, when Kate sends out the certificate, just ask her for that and I can provide that. That's typically the 1 hour presentation is on, but not the slides, but I will share that with you in PDF format. Do guardians need an order for an SNT? Yes. Somebody already answered that. That is correct. You're moving money around. You're creating a legal document, an irrevocable legal document. A special needs trust, you can't just say, oops, I made a mistake. I want my money back. You can spend it down and close the account, but have to get the judge to approve you establishing, in other words, signing the joiner and funding, moving that money. So our sample petition has both that in there. And we recommend that you give a copy of the joiner agreement that you have filled out but not signed to the court so they can see what you're doing. Are you naming the heirs? Are you naming the estate? Are you leaving it 100% to aged? Or letting the trust retain everything. Different, you have to think about that, talk that through with your attorney. What's the right thing to do? And we do have actually a way to leave 100% of the money to aged, and then we'll set up a trust for a disabled person with that money. We have to, go out, find that disabled person. So if any of your wards or family members that you want to do the trust for have another person that doesn't even have to be in their family that has a disability, whether it's a son, a daughter, a friend, or a spouse, then you might want to think twice about naming heirs and instead name 100% to aged. And then we have a special form that you can provide to us that allows us to then reach out to that person and say, hey, we have some money for you that we'd like to put in trust, you know. So, but we do have to verify they are disabled. So thank you so much, Ronald. Yeah, and yeah, okay. Does this also include guardian and attorney fees? We can pay for attorney's fees out of the trust. I believe that's the question, Vivian. Yes, absolutely. Now, you as a guardian, you know, should work with your attorney, but as a guardian, if you want to get paid or your attorney wants to get paid, you really should go to court and get a court order, because you know how the courts are now. They want to know, they want to approve your fees, even if they're being paid out of the trust. So the trust, remember, it is your ward. If you're a guardian, it's your ward's money that's going into the trust. The courts want to know about it. You need to tell the courts. And very often you have to provide the trust statements to the court. If some judges require that, some don't, on an annual basis when you do, you know, your annual submissions to the court. Which, you know, we can even run an annual statement instead of quarterlies or whatever. We can help you with that. But yes, and attorneys are getting their fees approved also, typically. Now, for the other expenses, you don't need a court order. Like if we're going to pay the rent or the mortgage or the other things, you don't need to get a court order for everything. It's just that the courts want to oversee your fees. That's why it's recommended that you talk to your attorney about that. Okay, we're just about at time. Does anybody else have anything? I don't see any more. Thank you so much for attending. We are not going to have a December webinar because a lot of people are very busy during at the end of the year. We are lining up our programs for next year. I am always happy to get suggestions on what other topics you would like to hear about. Sometimes I do the presentation, sometimes I have a guest speaker. So let us know if there's something special that's on your mind. Have a lot of trainings and videos on our website. I hope you'll refer to those to educate yourself. And I wish everybody a very happy holiday season. I hope to see you soon. Okay.